Hello, everyone. Welcome back for another fun episode of Thrive Live. I am so excited today to have Dr. Allison Imel online. To talk all about pelvic floor health. And this area, I don't think gets enough press. And so I'm very excited to talk about it. So welcome, Dr. Imel, and tell us about yourself. Introduce yourself.
Thank you. Thanks for having me. I've been on here before and I loved it. And so I was so excited to get invited to come back. So thanks for having me. My name's Allison. I'm a PA, so you don't have to call me doctor or anything.
Oh, I did that last time too.
Just Allison. It's easy.
Right.
So I'm really excited to talk about this stuff too, because you're right. It doesn't get enough press. I just finished with someone who said, do a lot of women, is this super common? And I said, it is so common. So a little bit about me. I work in the field of urogynecology. So I'm a PA in urogynecology, and I've been doing this for about a year. I've been working with women for 2 decades in nutrition and then in functional medicine. And I've always loved this field. When I was in PA school, I loved it. So I've been trying to get back in this particular field for a long time. So urogynecology is a subspecialty in gynecology and in urology. So it addresses issues of pelvic organ prolapse, stress incontinence, urge incontinence, vaginal dryness, and we address issues with sexual health. So that's I think all you need to know as far as a bio or an intro goes for me.
And again, sorry that I've known forever that you're a PA, and I always
that's okay.
That
is okay. No, sorry. Totally fine.
Awesome. Well, I guess let's first start kind of for those who maybe didn't listen or weren't able to attend your last talk. What is the pelvic floor? Where is it? Is it more than just the vagina?
It is so much. It's so much. In fact, it is so complex, which is, I think one of the reasons that a lot of people aren't getting in and doing anything about it, because it's a lot. It's actually a lot to manage at one time. So when we talk about pelvic floor health and pelvic floor disease, we're talking about the relaxation of the pelvic floor muscles. So if we're looking at you like a basket, like the bottom of you like a basket, you have a hole for your urine, and you have a hole for an opening for your urine, and an opening for your vagina, and you have an opening for the stool. And all of those things can be affected by having weak musculature. This can happen after carrying big babies, birthing big babies, tearing during delivery. It can happen after lots of strain, and it can happen after menopause. So you may not have any symptoms at all before menopause, and then after menopause, all of a sudden you can feel like a bulge at the opening. And so we have a weakening of those pelvic floor muscles, as well as a weakening of the walls of the vagina. And so there are lots of things you can do if you're starting to see early signs to prevent that from happening. And then there are lots of things that can be done once it's already occurred. So that's what's so wonderful about this field. I don't feel like anyone comes and can't get something done. But it does include also vulvar health too. We deal a lot with helping to make that tissue healthy and give it good turgor and prevent infections and urgency of urination. So it's a lot all in one spot.
It is. And also all just the nerve intervention or the word I'm thinking of.
Innervation.
Thank you. Yeah. I was like, intervention is not the right word. But all the nerve endings there and the whole, and the response that we get out of that. I remember when I personally went through pelvic floor rehab, that I was blown away at how much stress we hold there, and we just don't realize it, but how much stress even gets held in the pelvic floor.
Well, that's something that I actually get to bring up, and I feel really privileged and honored to be in this really vulnerable space with a lot of women, because we talk about that. This is not a comfortable thing to come in and talk about. I love taking the awkward out of it for women, because it takes a lot to get to that point where you see someone and say, okay, this is not okay, or this feels uncomfortable and I want to do something about it. But yeah, I mean, that's where our root chakra is, and that's our grounding, our security, our stability, our connection to like our ancestry. It's how we regulate our nervous system in the world. And so if there's something going on down there, not only, I know you're talking about like physical stress and like what we hold, but like we hold a lot there.
Yes.
So, I think that focusing on a lot of nervous system support too, at the same time, can make you feel more comfortable and make the treatment that you undergo for this more successful. So, but there are definitely specific physiologic things that we can address too.
Yeah. Well, yeah, the energetic, I love how you brought the root chakra, the energetics that we just hold in the pelvic basin is huge.
Yeah. I like that word, basin. I was listening just recently to Andrew Huberman's interview with Sarah Godfrey.
Yep.
And it was really great. So Sarah Godfrey is I know you know, but a women's health specialist, and she's written lots of books, lots of great books, Women, Food, and Hormones. I recommend to lots of people, all my patients. But she was just saying specifically, I think that the statistic was something like 80% of women suffer with constipation. And so, that's just a stuckness in that pelvic floor. So that is one of our number one things that we address with every woman. I say, if I could hang a shingle and do one thing, it would be to get women to poop. So I just want to give a couple of things that, we want to make sure we're doing for all of our patients. It's like making sure, number one, that everyone's pooping. And so we manage that with fiber, oral magnesium, like a magnesium ramp up, and ensuring hydration. And then I put most people on an anti-inflammatory diet just to get dairy, gluten, corn, soy, sugar, processed sweeteners, processed foods out of the diet. Because a lot of times we won't go to surgery at all until people can get their constipation under control. So there's so much to talk about. It's 30 minutes.
I know. I love what you already said in a nutshell.
You gotta poop. Gotta quit drinking diet soda. Yeah. So for anyone who hasn't experienced pelvic organ prolapse, do you want me to kind of walk through?
Yeah, I would say just go for it.
Okay. So I have a diagram. So if we're looking at you from the side, so we have bladder, urethra, vagina with uterus, and lots of women don't have these anymore. And then from hysterectomy, not because of any sort of weird chemicals and things, and then anus and rectum, and then this striation here. These are your pelvic floor muscles, and so oftentimes we'll see different kinds of prolapse, but the vaginal walls will weaken, and then the pelvic, you're not supported by your pelvic musculature as well anymore either. And so what can happen is in some people, the bladder actually herniates into the vagina. And so you can see that some women will experience a bulge at the opening. It could also be the rectum that's bulging at the opening. And you'll hear many women complain of having to splint. They have to push up on their perineal body, on the perineum, to make that bowel movement. So if any of you are experiencing this, if you have to push on your bottom to get that bowel movement out, go see a urogynecologist. Just go in and get poop in. They'll help you get poop in and get into pelvic floor PT. And then in a lot of women, we will see uterine prolapse. And so that's when the uterus is actually falling down into the vaginal space close to the opening. And so sometimes women will complain of a bulge, and then they'll go into their provider and they get referred in for just bladder prolapse. But it could be bladder, it could be rectum, it could be uterine, it could also be, if you had a hysterectomy, it could also be the top of the vagina where the uterus was taken out, and that's actually falling. And that is called vaginal vault prolapse. And so they can see a bulge there. That's a small bowel pushing into that vaginal space. So a lot of women can feel like completely horrified that this is happening. Oh my God, organs are coming out. And I think that the thing that's so important is to understand like why it happens. The collagen we don't make as strong collagen as we have more birthdays. I don't like to use the word age a lot because we can reverse aging. And then they also can have that weaker pelvic musculature that doesn't support them anymore. So some of the first things that can be done about it, we always send people to pelvic floor physical therapy. Like baseline, you just want to get those muscles strong. If you're postmenopausal, we'll often use vaginal estrogen. And that's anything from like standard prescription estradiol or estrase to compounded estrogen cream. We use other things to hydrate the vagina, which we can talk about. And that's usually the first step. A lot of women will come back and they'll just describe, like, they get their estrogen and they give a PT and they're like, I just feel a lift. I just feel this improvement. They're like, can it do that? I'm like, it totally can do that, you know. But then if those things don't work, we do talk about doing surgery. And so that's everything from removing the uterus and lifting. Sorry. Sorry.
You're fine.
Computer times me out.
Oh.
Everything from taking the uterus out and lifting up the top of the vagina to repair that bladder prolapse, to just doing vaginal surgery, where the surgeon I work with would go in and just do pulling the vaginal tissue together so it tightens it. Because, you know, not everybody wants to do surgery, not everybody's a good surgical candidate. People can do really well with non-surgical devices. So I have to open
Show us some of your devices.
Glad, sorry, I have to open this already. So for just pretty standard bladder prolapse, we'll use something called a ring pessary. And you fold it like this and you insert it in kind of like a tampon, and it expands and it holds up the bladder like a trampoline, just like a trampoline. So if the bladder were falling, just push it back up. And so then that can help with the bulge that you feel at the opening. With when the rectum starts to come out, something like this actually works. And again, people are like horrified, like, that's going to go inside me. Like, it totally is going to go inside you, because once the estrogen or once the vaginal tissue is well hydrated, it can accommodate these things, and you shouldn't feel it at all. But I hear the word game changer, life changing all the time for what the pessaries can do for the just the bulge that they feel.
Speaking about hormones, because we can dive into there, especially as, you know, like you were just to expand on what you were just saying, is when the vaginal tissue gets that estrogen and plumps up. Yeah. And we usually think about hormones more like hot flashes and moody and menopause, but there's a whole vaginal vault changes.
Yeah. So the vagina is kind of segmented into 3/3, and the top 2/3 have a lot of estrogen receptors, and so even if you've gone through menopause and your adrenals are still making a little bit of estrogen, it's going to get there. But in the front third, we don't have as many estrogen receptors, and so you can experience a lot of vaginal dryness. You can start to see urinary urgency, some stress incontinence. We haven't even talked about that yet. But pain with sex, that's a really big indicator for vaginal dryness or low estrogen at in the vaginal opening and around the urethra. And some women premenopausal can experience this vaginal atrophy too. So if you've been on birth control for a long period of time, or you're breastfeeding your babies, you're not producing the same levels of estrogen. And so you'll see, you might experience, pain with intercourse, or just pain with like working out, just friction, just because you don't have the same layer of protection. I have a good image too. I told Juanita, forgive my messy office. It's not that messy. It's just not aesthetically pleasing. Like Dr. Jenny's office. So what happens is these layers, I don't know if you can see if it's focusing. Yep. The layers of the vaginal walls get really, really thin like that. And so what we try to do with estrogen and other agents is try to plump it back up. And it happens really fast, like 2 to 3 weeks. That tissue it's just like, it's very similar to oral mucosa. It wants to heal. So you just have to give it what it needs.
What are some of your favorite vaginal plumping?
Well, I just prescribe, because I work in a nonprofit organization where we take all insurances and we really try to use what people have and try not to increase the out-of-pocket costs. So we'll use estrase, which is just prescription estradiol. But one of my favorites, Oh my gosh, these are non-hormonal. These are hyaluronic acid, the Reverie. They're kind of spendy, but they aren't hormonal. So you can use them before menopause. You can use them if you have any concerns about cancer risk at all, or if you just don't do well with estrogen. Those are amazing. Reverie, hyaluronic acid suppositories. And then I use a lot of the Bezwecken. I know you use in your practice too, because they use estriol, which is a really safe form of estrogen. And then they have a couple different doses. And you can use those before menopause too. I don't typically like to raise your estradiol levels because you're making estradiol before you go through menopause.
I got a question for you.
Yeah.
We're just kind of nerding out. I haven't played around with it too much, but I know there has been some studies on vitamin E vaginally with helping with vaginal atrophy. Have you used vitamin E and seen success?
Yeah, so there's an over-the-counter suppository called a Carlson Key E suppository, and that's the least expensive, most available one that I can send people towards, and it works great. It's not going to be like hyaluronic acid is like driving like a Maserati, it's pretty awesome. But like a Toyota works great, gets you where you need to go. So those little vitamin E suppositories do really well. It's the Carlson Key E. So that helps on the inside, on the vaginal tissue. When we're talking about externally on the vulvar tissue, vitamin E is amazing as well. And so it's my favorite stuff. Oh my God. This is called Yoni cream. Every girl needs this in their medicine cabinet for sure. So this is really rich in vitamin E, and it also has sea buckthorn oil in it. So we know that sea buckthorn also helps with tissue rejuvenation and hydration. So this stuff is available. It's only like $12 a canister, available online. You can use it externally. If a little bit gets inside, it's also great too. But for anything, for vulvar dermatitis, vulvar atrophy, pain with sex, it's amazing.
Have you seen any improvements with that, with like the lichen sclerosis?
Yeah, so
Okay.
I'm so glad you asked that, because specifically that lichen sclerosis responds really well to sea buckthorn and vitamin E. It's an immune modulated process, and both vitamin E.
For those listening, lichen sclerosis is autoimmune, like thickening and hardening of like the perineum, and
Yeah, we're looking for like that. We call it a hypopigmented keyhole pattern, and so that means that the tissue is not pink; it's light white, or it's a light pink and or white. And it kind of does like an hourglass thing around at the vaginal opening and then around the anus. It can be so painful for women. They get this like tissue paper vulvar skin, and the problem with it, one of the besides the discomfort, is that when it's not treated, it can actually lead to cancer, a vulvar cancer. So we like to treat it early. So some women will use steroids to kind of calm it down, but then I will use either vaginal estrogen and this, or sometimes one or the other. So just a little case. I did have a patient she'd never been diagnosed with it before, but she came in and I was like, oh, this is lichen sclerosis. And we started using this, and she came back in like 2 months, and I would not even be able to diagnose her with lichen sclerosis. I couldn't tell. She's like, oh yeah, it's all better. I don't have any more pain anymore.
it's amazing.
It is amazing. It is amazing. It's really hard to treat in a lot of women, and you don't want to be using steroids all the time because it will thin the tissue. So, and a lot of times in lichen sclerosis, you'll see, the labia, but then the labia minora can actually, they'll fuse with the labia majora, and so everything just starts to atrophy away, and you'll start to see some of that tissue come back. It's amazing.
That's pretty amazing.
Awesome.
I'm looking up the Yoni cream. That looks great.
Yeah, it's super clean. It's got
Yeah.
it's wonderful. It smells nice, but not too strong. I joke with women, I'm like, after you're done putting it on your vulva, you can put it anywhere. It's like it's a night cream for your vulva.
You can. Yeah.
It's so clean. And it doesn't have any hormone at all in it. There was something else I think I put on my list I wanted you to know about. Oh, the Julva. You've heard about this, right?
I have, and I'm wondering what responses you've gotten because I haven't used it a ton, and the couple times it was pretty mild.
Uh-huh. It's so interesting. I've heard like people come back like, oh my gosh, I totally wanted to have sex with my husband. And that's, that's what a lot of women want. They want it, right? So Julva is a topical DHEA cream that also helps to improve the vaginal health and vaginal tissue and vulvar tissue. But because it's got that little bit of hormone in it, it also kind of can boost libido. But I've heard actually good responses with it.
Good. I mean, I haven't done it too much, so, but
yeah, I think it's great. It's just a little cost prohibitive. It's like $65 for a small tube.
Yeah.
Oh, sorry. Here we go again. I'm sure I can set that differently, but I don't know how to do that. So, what's the other thing I was going to say? Well, the whole notion of just not wanting to have sex because it hurts is that's what a lot of people come in with, their like sort of their tender hearts. He wants to, it just hurts so bad. And so like anything and everything, creams, suppositories, gels. There's another one by Good Clean Love called BioNourish, and it's a little more affordable. It's got a lower amount of hyaluronic acid.
And I'll have, for those listening, I'll have links on all these so that you can grab the links later.
One thing we haven't talked about is incontinence.
Oh, right. Stress incontinence.
Yeah. So we see a lot of mixed stress and urge incontinence. So just to clarify, stress incontinence is leakage of urine with coughing, sneezing, laughing, and exercise. And then urge incontinence is leaking with a sense of urgency, not being able to make it to the bathroom, that whole key in the door phenomenon. So stress incontinence, we tend to see in younger women. So true stress incontinence is coming from like stress from childbirth or a weaker pelvic floor. So in stress incontinence, we've got the pelvic floor muscles. That's important. That's why PT is so amazing. But then we also have the urethra itself. And so the estrogen can help, or all these different things can help improve blood flow to the urethra. So we get really good function of the urethra. So you want to activate those pelvic floor muscles. Then you also want to tone that smooth muscle of the urethra. And so a lot of these things will help, but then we also use an injection of it's a collagen hydrogel injection. And when it's done in the OR, that goes and thickens up, it like narrows the urethra. So we are seeing incredible results with that. The surgeon does that in the OR. And it's awesome. It's called Bulkamid. And so if you're in an area where you can talk to a urogynecologist, if you're like, can't go to the trampoline park with your kids, or can't jump on the trampoline at all, or you're a runner and all of a sudden you're leaking, this is such a great option. This is another great thing for stress incontinence. That's not, you don't have to go to the OR for. It's called a Poise Impressa, and there are a couple of devices like this online. And so this, if you can see, it's inserted into the vagina and it presses up on the urethra. So it just comes in like a tampon dispenser. You push this up through, and then it expands, and it's going to hold up. It holds up the urethra. So this is like on Amazon. You get a sizing kit. I mean, just try it out. You're like, oh, I mean, so many. I love my job. It's just so fun because I'm like, oh my god, it totally works. Like, I don't know. So then you can go running, and they're disposable. So they're a nice thing to try on your own without having to go see a specialist first, just to see if any procedures or how you would do with any interventions.
Have you guys done much work with the O-shot?
No, we haven't done any of that fun stuff. No. I want all the toys, but
yeah.
no. Again, we're serving a different, a varied population. So
yeah. O-shot is expensive and definitely not for
everybody.
Everyone. Yeah.
This is pretty affordable. This is
awesome.
And then with urge incontinence, a lot of it, we can get so many women back to a baseline by just removing all the diet sodas, all the tea, the artificially sweetened beverages, like all the ice drinks, and so much of it comes from bladder irritants. So we can take, if you're going every hour and noticing that just start looking at the bladder irritants that are in your diet, drinking more water, and then cutting those things out. That's a big one. And then the estrogen actually helps with the urge incontinence. So improving vulvar health will improve the tissue right around the urethra. So you're getting better control.
Yep. And going back just to highlight more of your discussion on the dietary component, we know that the diet and the amount of sugar you consume directly affects your microbiome in these areas. And the microbiome is going to be affecting the localized immune system, inflammation, your receptors, all of that.
Yeah. So I feel really lucky that they let me talk about this kind of stuff in this environment, but I have Whole30 handouts in every room. And it's the easiest thing for me to do. And I would say about 30% will get on the diet and they are just like, oh my gosh, I can't believe how much better I feel. And it just removes all those common, I know you know, but removes all those common inflammatory agents. And we see a lot of recurrent UTI. So when I see recurrent UTI, I will look on their questionnaire and 9 times out of 10, they're constipated as well. And so if we can address the constipation, improve the gut microbiome, then usually the microbiome in the urinary tract balances out too. They come together, and the research is so strong on this. It's so great. We now know that current UTI is associated with dysbiosis in the gut. So
yeah, I've also seen that. I'm sure you have too, because I know you put it on your talking notes, but low estrogen with the recurrent UTIs.
Yeah. And so the thing that I think a lot of people don't understand is that estrogen brings the blood flow. Like you put estrogen on your vulva, blood's going to come there again. So you're going to want to have sex and you're going to have better tissue remodeling. And, but it also brings your immune system. Like you said, your white blood cells come with your blood. So then you're able to fight off whatever E. coli or Klebsiella is coming from the gut.
Yeah.
It's pretty great. I've never worked in a place where, in a field where people get better so quickly.
Yeah. I love it. Well, you're not only addressing the structure, you're addressing the biome, you're addressing the immune system, you're addressing the hormones, you're doing that greater the heart, the chakras, you're doing the greater orchestra of the whole pelvic basin.
Yeah. And, I just want to plug again, pelvic floor physical therapy. And so, this is pretty hot. Like we're not talking about organ prolapse and surgery and the vulvar stuff. It's not super popular yet or mainstream, but pelvic floor physical therapists are all over TikTok and Instagram and making courses. And there's so much that pelvic floor therapy can do for like painful bladder spasm or pain during sex or constipation. One of our pelvic floor physical therapists who's here spends a lot of time with people, getting them to make bowel movements correctly and fully. And everybody comes in like, oh my gosh, her name's Lucy. Oh my gosh, Lucy's so amazing. I'm like, I know, she's just great. She's like, I didn't know that pooping could be so complicated. She kind of complicates it and then simplifies it,
Yeah. Yeah. I've seen that a lot with my patients who go through the pelvic PT, is that the bowel movements become a lot better because it's all in that greater pelvic basin.
Yeah. And I just think that we, as women, we should have started PT. You just start PT during pregnancy and just right after pregnancy, right after delivery, and then just keep going. A lot of people who are coming in their 60s and 70s, like, why has no one ever told me about this? Like, well, we're starting to, and kudos for you for bringing it up. And, we can take each one of these little things that we tapped on and just spend an entire, half hour on it.
Totally. If anyone listening, if you have anything you want us to go more deeper in or any questions, just pop it into the chat box and we can spend our remaining time diving deeper into that too.
See the other things that we've kind of put down, I think we kind of covered it. Just, knowing the signs, if you're feeling a small bulge at the opening, or if you feel like you're sitting on like a ping pong ball, or if it's, becoming more difficult to empty your bladder. So you sit down on the toilet and you stand up and there's more coming. That might be an early sign of some prolapse, where PT and, doing some sort of estrogen or hyaluronic acid product would be just enough for where you are. But, just talk to people about it. Talk to your women friends about it.
Yep. Spread the word. Words. Talk to your friends, any female in your life. Talk to them about this.
I know what I'm saying. Have you ever experienced that?
I know.
Well, it's so funny when people come back in after they have the surgery or they get evaluated to prepare for surgery. They come back in and they say, I was talking to so-and-so and it turns out she had the surgery. I'm like, and you didn't know, huh? She's my best friend. I didn't even know she went through this. And we just shouldn't have to, because there's so much we can do to support each other.
Yeah, it's been hush hush for way too long. And it's not even just the bulging, but also, the pain with sex, or is painful inserting tampons, or vaginal dryness, anything in that arena.
Yeah, and I know we're getting ready to finish up, but I told you that was, I don't think I told you, but this morning, my meditation, I listen to this one all the time, and I had never heard this particular line in it, but it was from Sarah Blondin on Insight Timer, and she's talking about loving and listening to yourself. And she said that you should be round and plump with love. And I was like, oh, that's so perfect for today, because we want all those tissues just to be plump and supple and round. And then, so, I was just telling a patient this morning, tending to your vulvar health and your pelvic floor is like this act of self-love, especially as busy mamas and we're all working, and it's hard to take time for yourself. Like, you could put some yoni balm on at night. It's called female rituals. They're like, get in the ritual of taking good care of your vulvar skin. So
I love it.
yeah, it's great stuff. It's fun.
Awesome. Well, I don't see any questions coming through. So I will make sure that all the list of links and resources that you send over to me are available on the recording page. And thank you so much for coming on and talking about vaginal health. It's so important. And this was a great segue, because last week I spoke all about the vaginal biome. So
Perfect.
Yeah,
that the hyaluronic acid suppositories are just so amazing for, I don't know, did you mention those too?
I didn't get into as much. I spoke more about like why the biome was so important. Then I ran out of time. So this was perfect.
Yeah. I mean, I don't know how, I think because I spoke, 90 miles an hour, but there's just so much to talk about, and it's so much fun. And again, the name of that one that I've been using is Reverie, and patients can sign up for subscriptions so then they can get a discount, because it's pretty spendy.
Okay, perfect. Yeah.
So everybody's going to be pooping, and they're going to be putting on their vulvar balm, and they're going to be doing their pelvic floor exercises.
Yep. I think the link that I didn't see is Carlson. Is it K-E?
Carlson's Key, like vitamin E is key.
Oh, got it. Okay, perfect.
Yeah. And I think all the Bezwecken ones that we use at different levels, they're all on full script.
Yep.
And Carlson Key is also on full script.
Oh, okay. Great. Makes it even more easy to access.
And they're simple. It's like cocoa butter, vitamin E, that's it. They don't have anything,
Okay. Perfect.
Thanks, Dr. Jenny.
All right. Thank you so much for coming on. Everyone have a wonderful weekend.
You too. Have a good weekend. Bye.
Bye.